Psychosocial approach in social casework practice. Introduction. Social casework as a method of social work is an individualized approach to solve problems of people in an agency by a professionally trained person, namely social worker. Professional social worker, while practicing social casework, makes use of various theories. Theory gives supportive structure and serves the purpose of intellectual and emotional security to the worker who is working with client. It also gives direction and ability to predict the outcome of the given treatment. Objectives. On completion of this lesson, the student will be able to understand the psychosocial approach and how it deals with the problems of the client, and to grasp the nuances of crisis intervention and in treating the problems of the clients. Psychosocial model in social casework practice. Among the first to describe various treatment approaches in social work with individuals, Hamilton comes in the forefront. Her approach has been essentially based on systems theory addressed to person in situation of gestalt or configuration. At the start, it was called diagnostic, later termed as organismic, changed to differential, and in end as psychosocial approach. The basic objectives of the approach was to help or treat a person in the context of his interactions or transactions within the external world, which may be his or her family, social group or educational or employment milieu, or any social system of which he or she is a part. The frame of reference in this approach is Freudian. The change to be brought in either in the person or in the social system or in both, which requires both direct and indirect methods of treatment. Here, the worker becomes a provider or modifier or locator or a mediator or a creator. The treatment process conceived as a blend in which different proportions of different professions working together towards totality of a case. The concepts changes over time as they are no static. The dynamic concepts of social casework changed from organismic to psychosocial model. The psychosocial approach tries to assess person in situation. The theory views the situation as a whole as it follows a gestalt approach in the individuals, and interaction or transaction with the external world has to be understood by the client. While studying the case, the social caseworker has to understand the interaction of the family and the client and the educational milieu, employment milieu, or any other social systems required for assessment. The caseworker first follows Freudian theory to understand individual personality, and the emphasis is on ego and its adaptability. That is termed as organismic approach, which was gradually replaced by psychosocial approach. In psychosocial approach, the caseworker deals with the problem by knowing client's needs and by responding on individualized ways. The caseworker understands the need of the individual as a discrepancy in adaptation between person and others. She also identifies interactional factors responsible for discomfort. The casework treatment is the modification in social and interpersonal situations or the environment. The worker-client relationship is the significant in the treatment, which develops and verbal and non-verbal communication of the worker and the client. The professional relationship will determine the degree of help given to the client. The worker also arranges for the provision of services and ultimately resulting in change, which is objective of treatment. Values of psychosocial approach. The caseworker has to accept the client as she has commitment to the client's caring and welfare. The relationship must be others-centered and she should give importance to the needs of the client. The caseworker has to understand client's situation objectively without any bias. The caseworker must recognize the client's right to make his decisions and values and in encouraging his or her self-directive behavior. The caseworker must recognize the interdependence of his client and others, and there may be times when client and self-direction has to be limited to protect others from harm. Origin of the approach. The psychosocial approach can be traced back to Mary Richmond's formulations. Later, Sigmund Freud, Bertha Reynolds, Charlotte Toyle, Florence Day, Annette Garrett and many others contributed in mid-30s and later. Behavior sciences gave an adequate foundation with the contribution of Sigmund Freud, Abraham, Anna Freud, Alexander, etc. Early psychologists Dollard and Allport added their interest and understanding. Henry Murray and his associates have incorporated Gestalt psychology to this approach. Social sciences contributed with knowledge of family and the social influences of child rearing, and studies on marital and sexual behavior have become special interest. Cultural anthropology used in their approach as it bears the influence of culture on the development of personality and on the child rearing. The initial stage, the casework treatment varies with length of time. Short-term treatment is possible with 2 to 3 interviews, whereas long-term treatment involves the client in 3 to 5 interviews. Tasks in initial phase. The caseworker will arrive at an understanding with the client why the contact is taking place. Establishes relationship with client to enable him or her to use worker's help, engaging the client in effective treatment. Beginning the treatment itself. Gathering information needed for the psychosocial diagnosis and for guidance of treatment. Understanding reasons for contact, the worker asks very simple question why the client came to the agency. If his or her reply shows that he knows the purpose of the agency, interview can be started. If his reply is ambiguous, the worker explains the agency service. The worker also conducts interview with the person who referred the client to the agency. Clients sometimes fail to recognize the need. Worker has to pursue further. Casework with poverty group is an example for that. Establishing relationship with the client. The client has trust in the worker for her competence and goodwill. Goodwill of the worker originates from her greetings. Voice and facial expressions also included. Because of certain fixed ideas about worker developed as a result of friends and relatives, fears and complexes dominate the client. Factors of class or caste intensify these feelings. Specific transference reactions are activated by dependence. Awareness of worker slowly replaces it with trust as the worker demonstrates respect for client's rights and desire to enhance self-direction of the client. involving the clients in treatment. Treatment may be simple or complex. The treatment has two aspects. One is motivation and other is resistance. Motivation can be assessed by observing the client. How much the client wants to change, how much he or her is contributing to change, how much discomfort he or she has, and what level of optimism he or she has about the possibility of favorable change is important. When client experiences too much discomfort and helplessness without any hope, experiences apathy and becomes weak in his motivation. If it is too little discomfort also, there will not be any reason for him or her to change. The most important task in the initial phase is to bring the client at a degree of discomfort and hope for a favorable motivation to change. If the client is anxious and depressed, the worker has to relieve him from anxiety. Sometimes client or his or her referral thinks change occurs outside or the expected change will be brought by the worker and not by the client himself. The worker has to correct the false notion the client is having by providing necessary and relevant information. The client's resistance. The client's resistance depends on anxiety involving in taking help from the worker and also on fears regarding what is involved in change. Treatment involving change in client meets more resistance than external change. Workers' comments increase anxiety and resistance in the client. When the client is not self-referred, the anxiety and resistance is even higher. Ignorance about agency and casework treatment, it is still more higher. Previous experience with agency or information about agency from friends and relatives increases resistance of the client. Feelings of guilt, shame, fear or fear of social disapproval or anxiety makes the resistance even stronger. Ways of reducing resistance of the client. The resistance of the client can be reduced by discussing the client's negative and ambivalent feelings related to seeking help. The misconceptions of the client regarding the service of the agency have to be identified. The worker makes it clear that his or her service is optional and he can decide to have or not to have his or her decision to take help or service is delayed. The worker has to give the necessary information to the client. Treatment in the initial period. Treatment starts with last interview. Some workers wait for diagnosis, sometimes non-specific treatment is given after first interview. The client is allowed to ventilate his or her feelings. Psychosocial study. The worker understands the needs of the client and the client's assets are explored. The client spontaneously gives the information. Worker guides the flow of information. Person-in-person interaction with situation is assessed. The worker has to understand beyond what the client narrates. She has to note down the past history, her observation of the client's personality and his expectation also. Past history. The starting point of the problem about the client's family, friends and work milieu. Personality. The client includes conscious material and current realities, and finally the expectations of the client have to be assessed by the worker. What he or she asks for is explored. to find out what he or she is seeking for correcting interpersonal relations or faulty communication, or what change is required. Is there any difference between interpretation and the actual event? What are his role expectations? Any distortions due to transference and differences needed for clarifications have to be explored. Crisis intervention in social casework practice. Social casework is a method of social work which enables individuals to solve their problems. There are number of therapeutic approaches in social casework with which individuals are helped to solve their problems. Crisis intervention is one among such effective therapeutic approach. The intervention centers generally deals with problems of violence, physical abuse or rape or suicidal attempts, and also sometimes natural disasters. When a chronic infection stigmatizes the individual and causes threat to survival, or when an individual's situation induces acute anxiety, helplessness and hopelessness and loss of control, crisis occurs to the individuals. Sometimes emotional crisis exists where one is affected with the conditions mentioned: intensely threatened, completely surprised and unaware of what happened, emotionally disturbed and loss of control. Emotionally disturbed when unable to find solution to the problem. The social caseworker begins her interaction starting from where the client is. She reassures and supports to make the client speak out his or her crisis situation. The caseworker, while acknowledging the feelings of the client, continues to explore the matter, and the caseworker never says that the client is overreacting. Generally, the client in a crisis experiences a blow or shock. He or she also withdraws alone with sorrow and anger. Role of the social caseworker. The role of the worker accepts the feelings of the client without judging or without commenting the behavior of the client. The caseworker gives emotional support in case of fears and sadness. The caseworker uses guided or structured questions to elicit information from the client, and worker will not ask any directed questions to the client. Basic principles. As caseworker, she will not bother about past feelings but takes only present feelings of the client. The caseworker tries to facilitate, to understand and to clarify what the client regards as crisis by processing the situation or trauma. The worker comes to the conclusion what exactly are the feelings of the client. The caseworker uses the techniques of questioning, observation and finding the feelings of helplessness, hopelessness and loss of control. The worker observes and understands whether the client shows strength or ability to make decision or otherwise. The caseworker at the end of the interview gives a brief assessment of position of the client. The worker also ascertains the most as well as least threatening aspects of crisis. The social caseworker selects one aspect to begin work for which the client is given some support. Both the worker and the client have to agree on what is to be done to resolve or erase the crisis. During the therapy, the worker always faces the problem of denial from the client, where she has to repeat the information she has given. A 7-stage mode was developed. The worker tried to identify the needs of the victim. Survivors or others make appropriate referral to hospitalization or outpatient treatment. The worker tries to resolve stress, psychological and trauma and emotional conflict. Complete biopsychosocial assessment should be done promptly. The worker has to establish professional relationship with the client. The worker identifies major problems that led to crisis. The client is given control and power to discuss his own history. The worker has to develop model coping style with her skills and techniques. By using challenging responses, the worker has to change the maladaptive beliefs and thought and explores alternative coping. Treatment plan and follow-up. Summary. The psychosocial approach and crisis intervention are described in this lesson. The social caseworker helps the client in solving his or her problem. The theoretical approaches in social work give guidelines for the worker in her practice. The psychosocial approach tries to assess person in the situation. The theory views the situation as a whole as it follows a gestalt approach, that is, individual's interaction with the external world has to be understood. The approach gives importance to relationship, involves the client in treatment, helps him to come out of the resistance and motivates him for change. Crisis intervention is required when a chronic infection stigmatizes the individual and causes threat to survival, or when an individual's situation reduces to a acute anxiety, helplessness and hopelessness and loss of control. Crisis occurs to the individuals. Accepting as he or she is and by giving emotional support, the caseworker finds out the history of the problem with structured questions. The worker arrives and brief assessment and together with the client come to agreement to resolve or erase the crisis. Questions. What is acceptance? What do you mean by objectivity? Describe the role of professional relationship in psychosocial approach. Explain the term resistance. What is the meaning of crisis intervention? References. Gordon Hamilton, 1948. Theory and Practice of Social Casework, New York, Columbia University Press. Perlman, Helen Harris, 1957. Social Casework, A Problem-Solving Process. Rawat Publications, New Delhi. Norton, Helen, 1959. Social Work with Groups, New York. Columbia University Press. Bistek, Felix, 1957. The Casework Relationship. Chicago, Loyola University Press. Coyle, Grace L., 1948. Group Work with American Youth, New York, Harper and Row.